What are the top three things that you can do to avoid forming gallstones, or at least reduce the risk of forming gallstones when you're on treatment with Wegovy or Mounjaro? I'm Professor Frank Joseph, consultant endocrinologist and founder of Dr. Frank's Weight Loss Clinic. The first thing that we would probably do to try and support you to avoid forming gallstones is have a more gradual and slightly slower weight loss trajectory when you start Mounjaro. For a lot of people, when they start treatment, the initial weight loss can be rapid. But if you're really concerned about getting gallstones while you're on treatment with Wegovy or Mounjaro, one of our team can guide you through how we might do a slower dose escalation, or how you might not go too quickly into a calorie deficit that is excessive. Second thing that you can do is avoid high-fat foods. We know that high-fat foods directly have a link to forming gallstones. The third thing that you've got to remember is that your diet should consist of whole foods, so whole grains, complex carbohydrates, and also a lot more fiber. And if you can incorporate that into your diet, you are on a winning streak to try and avoid forming gallstones. Obviously, you still have to be vigilant. And the important thing to remember is look out for any abdominal pain, usually on the right side of your abdomen, which is where your liver and gallbladder sit. And if you do get that, you got to report it to ourselves, your GP, or one of your clinicians that will look after you. So for a healthier, happier journey to getting to that target weight, always speak to a consultant or your clinician so that you can understand how you can avoid and lower that risk of forming gallstones.